Mark, starting tomorrow, people 18 and older can book an appointment for a COVID-19 vaccine in Ontario's hotspots. While many Ontarians who qualify are excited by the announcement, one physician says while it's welcome news, there are still some problems with the rollout.
The last few months, I've been having some anxiety about it. I like to go outside for a run or something like that, once or twice a week. And you want to make sure you have to think about what time you're going to go so it's not busy. And then going to the grocery store, you try to go on an off time as well.
Rachel Houghton lives in a hotspot in Toronto. Tomorrow, as of 8 a.m., those 18 and over living in one of the 114 hotspot communities in the province will be eligible to book a COVID-19 vaccine appointment at a mass immunization clinic through the provincial booking online system or directly through public health units that use their own booking system.
A little bit of hope or a little bit of sense of relief that, things are moving in the right direction.
In a news release issued today, Minister of Health Christine Elliott says with additional supply, our government is increasing access to the COVID-19 vaccines in the communities hardest hit by COVID-19. The Ontario government adds this move will support the strategy of allocating 50% of vaccines to hotspots over the next 2 weeks. Palliative care physician Dr. Nahi Dasani says while this is a big step, it may not be enough.
But that's not exactly what the recommendations were. The Ontario Science Table recommended 4 weeks of diverting vaccines to hotspots to create the best possible scenario. And so it really remains to be seen whether this will be enough. It's important for Ontarians to realize that the government has really implemented half of what was actually called for. That's in addition to other half measures like paid sick days, where they offered 3 days instead of the recommended 10.
All adults in hotspots have been cleared for immunization for some time, but they couldn't book through the provincial website. Dr. Dasani says it's apparent adults are eager to get the vaccine given the long lineups at pop-up mobile clinics in places like Scarborough, Toronto, and Peel.
Many workers work overnight shifts, are working double shifts overtime. People are not necessarily available for 9 to 5 hours or even in the early evening. And so I wish that our government would spend more time figuring out how to get our vaccine clinics to run 24/7.
Eligibility will expand even more on Thursday. The province says online bookings will open up to residents 50 and older. Others included in this expansion will be people with high-risk health conditions, those who can't work from home, including teachers and school workers, as well as First Nation, Inuit, and Métis people. While Houghton is ahead of this queue, she's cautiously optimistic. How do you think you're going to feel after you finally get your first dose of your vaccine?
Try not to think about it because I don't want to get my hopes up because I don't know when it's going to happen. But I don't know, I'm probably going to feel pretty excited.
If supply holds, the province plans on making those 18 and older eligible province-wide for a shot at mass clinics as of May 24th.